Welcome back, everybody. So we now have our session 2, and what you're going to hear is from a bunch of our health professionals. We have people who work across social work. We have people who are working across a variety of allied health careers, and we're going to have some people on the call who'll be able to respond to any questions you have. So please, if you have a question, something you'd like to know about a career in health, you can pop that in the chat and we'll respond to you. You'll also have some video. So we're going to have some information from our GAP students, from our early career graduates, so people not that much older than you who have ventured into a career in health. So in a moment, I'll show you our first video link, and you'll get to hear a bit more about careers in health.
So I'm a new grad physiotherapist at GV Health. So generally a typical day for me, I'll start work at 8:30. I'll get to work and go into the office, sort of collect my list of patients for the day, and then start working out how I'm going to plan that. So currently I'm working in community rehab, which means that patients that have already left hospital or have had a surgery and gone home or something like that and are coming back for some more physiotherapy will come and see me. But as part of my role, I'm a rotating grade 1 physiotherapist, which means that every 4 months we move to a different area in the hospital. So currently I'm working in community rehab, but in a month's time I'll move somewhere else, and it could be on like one of the acute wards, so seeing people when they're actually in hospital, or in somewhere like rehab. I think for me, when I finished uni, I had no idea what kind of area I wanted to go in, and with physio there's so many different areas that you can go into. So being able to have a job where I can rotate through different areas without actually having to change jobs was really attractive for me. So I was actually pretty lucky. I knew quite young that I wanted to be a physio. I was always into a lot of sport and things like that, and spent a lot of time at sort of private practice physios with various injuries when I was younger. But initially it was more the sports side of things that had attracted me to physios. I didn't even know that hospital physios really existed until I started the degree, and then I found a whole nother world, which was great. I think in year 10 I'd done a work experience sort of week of placement at a physio clinic and had really liked what they did there. So that was sort of what inspired me to do physio. I tried to pick subjects that would help me have a better chance of getting into physio in terms of like the score you needed and the prerequisites. So I think in year 12 I ended up doing physical education, I did chemistry, I did maths methods, specialist maths and English. So that was my selection, but I know there's sort of other ones you can do at a uni. The first couple of years, so year 1 and year 2 was pretty much all on campus, so all coursework that we did, and we covered a lot of the coursework in the first 2 years and did a little bit of coursework in 3rd year, but then pretty much from halfway through 3rd year right until the end of 4th year, we were just placed out on 5-week placements at various different hospitals or private practices or other sort of places. I really wanted a hospital job coming out of after going on placements and finding out a little bit more about what physios actually did in the hospital and the impact that they could have on people's lives and things like that. Often they're a lot more competitive to get into after uni, and so going rurally is something that can be a really great option for people to sort of get your foot in the door and get into that hospital pathway. If you were in like one of the big sort of metro hospitals in Melbourne, you might find yourself in a very specialised area, only seeing like sort of one type of patient at a time, whereas at GV Health you're seeing lots of different types of patients from lots of different walks of life with lots of different conditions, because it's sort of, a smaller health network, so there's less opportunity to separate them out, which is great for experience.
Hi everyone, I hope you enjoyed our video on physiotherapy and perhaps taking some notes as I suggested earlier. We have a few people on the call who are excited and want to talk to you about some of these interesting careers. But we'd like to show you our dentistry video first, and that's an interview with one of our young graduates here at GV Health. So we'll show you that and then we'll come back. Remember, you can put any questions that you may have in the chat, or any teachers that are out there who want to raise anything, questions about career paths. By all means, the chat is a great area and we can respond to you throughout the day. Thanks.
I started in March 6 weeks ago, so 6 weeks there, and I'm having a great time. I used to hate coming to the dentist, and I hated it. Made me quite nervous, but I think when you've experienced on both chairs, so the dental chair as a dentist and the patient, you kind of empathise with the patient, so you can figure out what they need, how they feel, and how you can make them feel at ease. Every patient has a new story, a new presentation, so you have to deal with that, and you have to alter what you're doing and really think on your feet. And I think that's what's fantastic about being a dentist here, is that it's not just one. Every patient's a unique patient, unique presentation. And I started off doing a double degree because I wasn't quite certain what I wanted to do. So I started off engineering and biomedicine. I quickly found out that I didn't want to be a pen pusher, didn't want an office job. The medicine side was for me. So I dropped engineering, picked up science, and still did a double degree, and then really pursued medical type subjects. Kind of enticed me into dentistry is you get to see the same people over and over again for a long period of time. For example, you might see kids grow up, you might see people grow old. The variety is there. So I did a double degree undergrad at Monash, and a lot of my friends got into medicine, other health sciences straight away. So a lot of my friends I had spoken to quite a lot about what they did, where they were at, what type of things to expect. A lot of them were all very encouraging. They loved health sciences, so I think they were a really good support network. My grandfather was an ophthalmologist, and then my parents, always helpful and supportive. I think I try to surround myself with people who have had experiences or willing to help. Yeah, the brilliant thing about dentistry is that you can graduate and you can work as a general dentist, or you can specialise. I think what I'm likely to do is sit my primaries, which are the exams that you kind of sit in preliminary to specialising. And then I really enjoy orthodontics as a specialty. So that's braces, smiles, that kind of stuff. I think firstly, it's always important just to keep your options open. Never close that door, because you might want to revisit it later on in the future. Secondly, if you don't get into the course or the degree that you really want to get into, don't lose hope. Just continue on, because there's so many courses that offer, and there's like a pathway, and a step up to it. So even if you don't get into the uni you want to get into, you don't get into the course you want to get into, there's always ways around it. I've had friends that have tried and got into medicine, tried and got into law, and I think just, you've got to stick with it.
When I was going through high school, I sort of always enjoyed biology, a bit of chemistry, sort of always knew I liked science, but didn't really have a lot of direction. I sort of found myself, I enjoyed science, so I decided to apply for the Bachelor of Science down at Melbourne Uni, and then, started doing like mainly anatomy, physiology subjects, neuroscience. Developed a bit of a passion for it then, but still didn't really know what I wanted to do until about second year. And it might sound odd, but we did like anatomy labs where you sort of get to learn more about the human body, you get to see real specimens, learning the anatomy and seeing how it can impact patient health, and also pairing that with the physiology that I was also learning. Sort of, began to gather an appreciation for what goes on, I suppose, like beyond the skin. And then I just sort of realized I like interacting with people, like talking with people and helping people. And if I compare that with my passion, like of just, enjoying anatomy and physiology, then that's a career for me. And as a medical student, your role is to sometimes, you're basically shadowing the intern, especially in your final years. You just follow the intern around, watch the jobs that they do, and then try and, write medical notes. You might get to do an examination, always kind of thinking about the management that's going on and watching patient interaction. Once we enter medical school, you kind of get a form that you have to fill out, like whether you'd want to go for your clinical years, so for all the practical components, whether you want to go sort of inner Melbourne, outer Melbourne, or into rural places. And so being a rural country boy, I sort of, wanted to give back to the rural community. Immediately after high school, you get that small town mindset, and you always wonder what else is out there. So I think for me, coming to Melbourne wasn't the issue. I knew I wanted to kind of experience that big city life. Then I think after you move to a big city and you're kind of away from those family supports, you sort of, you realise that you miss having that support. There's sort of, if you ever needed help, it was always very clear, especially getting into postgrad, getting into medicine, it's always very clear that there's supports out there for you. It can feel very isolating. You sort of get that imposter syndrome, like, oh, I'm in medicine now, I'm going to be a doctor. Like, if you don't have those thoughts going through your head, you're a very confident person, which must be very nice, but I certainly wasn't one of them. Yeah, knowing those supports are there is really helpful. Lots of people that I see throughout my day, sort of, when you see the doctor that's, overworked, or the nurse that's, had back-to-back shifts, or they're just everyone that's kind of getting through the day despite, being understaffed, hard circumstances at home, whatever it may be. I think there's inspiration to be found in a lot of people. I know in my own personal life, there's people that I definitely look up to. My partner, for example, she's a medical student just like me in the year below, but her schedule is, unbelievably packed. So she's a constant source of inspiration. She always gets the work done and always has a smile on her face. I think that's one of the things I like to take away from anyone I meet, is sort of having that positive attitude and being there for other people. Even though times are tough for you, you can definitely make a difference in other people's lives.
Hi everyone. Thanks, and I hope you enjoyed our video. We're now going to hear from Emma and Di. So Emma is with GV Health and Di is with the University of Melbourne. Again, if you have any questions, put them in the chat area and they'll be able to, or one of us here on the panel will be able to respond to you. So over to Emma and Di.
Hi, Alison. I just want to say that the host won't allow me to start my video. So apologies that there's no video, but I'll let Di answer any medical or dentistry related questions. We're very lucky to have Di from University of Melbourne today.
Hi everyone, I'm Di from the University of Melbourne. If you've got any questions, I've put some little things in the chat that can help you. It's just one of the great opportunities for you in medicine is you can actually learn regionally. Instead of going to Melbourne, you can actually take up an opportunity at the Bachelor of Biomedical Science medical at La Trobe University. It's weighted. Mark is at least 70, and if you're got an ATAR of at least 80, you are eligible to apply for that. So it is a great opportunity. I'll stop sharing that screen. Emma, you're on mute.
Thanks, Di. It's always one of the hazards. You don't want to have feedback, but then I can forget to start, so apologies. Thanks, Di. While we're waiting for any questions that might come through from the audience, I also wanted to note regarding allied health more broadly that there are actually 27 different allied health therapy and science careers available. So it's a very broad area, and I'll send some information. I'm sure your careers teachers are already aware, but I might just send a summary of the different careers and encourage you to explore some of those lesser known options. Allied health are very collegiate people. We love to work in teams in healthcare, working alongside other allied health, medical and nursing. We get to focus and specialise in a particular area often in our clinical streams, but we all start within our professions at a more junior level in a bit of a generalist area. And then we have opportunities to specialise in something that we're really passionate about. You could also go into a management pathway of multidisciplinary teams or run your own private practices. And there's also research and education opportunities both in universities as well as in hospitals for allied health staff. So there's a lot of career opportunities for allied health, and we'll be watching some more videos about that. I've also got other panellist members here. Sarah Hay, she is a medical imaging technologist, and Robin Hucker, who is a social worker by background, but our senior mental health clinician at Goulburn Valley Health, who'll be able to answer questions about that. I'm still looking, but there's no particular questions. So what I might do while we're waiting, just before we start our next video, and I'm going to get Sarah to do another, to do a little bit of a rundown of her thing, but my clinical background is podiatry. A lot of people just think, oh, feet, they're not the most interesting things, but I have to say our legs and our feet keep us mobile and active, able to engage in sport and do all the sorts of things that we like. And podiatrists specialise understanding the pathophysiology, which just means what can go wrong, what all the different nerves, blood vessels, muscles, bones, all the things that we need to actually keep us up and working. And we diagnose musculoskeletal problems of the lower limb. We look at skin disorders, and my area of specialty is in limb salvage. So people can have wounds on their feet and legs that mean that they might be at risk of having an amputation. And it's very rewarding working in multidisciplinary teams to help heal wounds and have people having, lives where they're able to engage in activities that they like to do. Podiatrists work in public and private practice. Some people like to do biomechanics and work with kids and sports medicine. There's a lot of general foot care as well. Podiatrists can order imaging, and I'm a prescribing podiatrist. That means I can write scripts for pathologies or things that go wrong with feet and legs. So that might be infections or pain relief or treating allergic reactions, that sort of thing. And we get to do things like undertaking minor procedures like biopsies, and we put people in casts when they have conditions where there are fractures or other sorts of stuff. So I think I'll leave that. That's all my blurb on podiatry and allied health generally. And are we playing another video, Alison, or will Sarah Hay just talk a little bit about medical imaging technology?
I usually come in, get my temperature checked, go to my locker, put all my things away, and then I'll jump on a computer that's free, get organised for the day, and then I'll head down to the ward that I'm working for the day. So I work with the physiotherapist, so usually I'll be helping them with patients, or they'll give me a list, which is what I print out in the morning, and then I just go down that list with patients to see and do rehabilitation with. The physios will write out a program to run through with the patient, and the program will have exercises. The program exercises vary from each patient because every patient has obviously a different diagnosis. So some will have complete knee replacements and hip replacements. Yeah, I love it. I love getting to know all the patients because every patient has a different story to tell. So
for me, I'm in occupational therapy and speech pathology. I guess my whole life I've heard about health. My mum was trained as a theatre nurse, so it's definitely something that I've always just heard about health and really been passionate about women's health for a long time, I guess. So in Year 10 I did placement here, a work experience, and loved that, and then moved on to doing the VETIS program in VCE doing Year 11 and 12. So I did the Cert 3 in nursing and allied health and did placement here and absolutely loved it. So knew that I didn't want to go straight to uni, and a gap year position here, perfect fit to where I am in life currently. I don't have a specific pathway currently, really enjoying speech pathology, and so looking definitely a lot into pathways into speech. But today, for instance, I started in occupational therapy with a breakfast program. So helping and observing patients, eating breakfast and writing notes on what they've been doing and what they've been up to. Then in speech for the rest of the day, really focusing on communication and dysphagia, so swallowing. On rehab ward, most of the patients have come in with a stroke, and so communication is a really major part that's been affected through that. And so trying to get those patients talking more about their daily lives and family members, just to improve their overall life skills, and communication is really important to them to be able to then focus on different aspects as well.
Welcome back, everybody. I hope you enjoyed our video with some of our students. As I say, not much older than yourselves, and who are here working with GV Health and having a really, really good time. Thanks, Emma. So we are going to hear from a couple of people who are joining us this morning. We have Sarah and we have Robin, and I'll let them talk a little bit about themselves. So if you just give me one moment, we need to swap chairs.
Hey everyone, so I'm Sarah. I am a medical radiation technologist, also called an MIT in Australia, as well as a radiographer. I've been at GV Health for the last 3 years. Before that, I was in New Zealand, where I'm originally from, and I trained in a rural centre, much like Shepparton. So the awesome thing about this career is you get to mix science as well as a bit of art. My main job is to try and get diagnostic images for doctors to help with patients' treatment. And 90% of patients who come through the hospital will interact with a radiographer at some point. So we have a really crucial role, which is sometimes underplayed and people forget about us. So to be one of us, you do a 4-year degree through one of the universities in Australia. And during that time, you'll spend quite a bit of time out in clinical placement. So you'll spend time out rurally in places like Shepparton, Albury, Wangaratta, or you'll go to the metro centres in Melbourne or Sydney. So once you graduate, one of the awesome opportunities you can have is you can travel with the degree here. Australian graduates are in demand internationally. And during your time when you graduate, you can also specialise in mammography, CT, MRI, angio, theatre, fluoro, the list goes on. There's lots of different things you can get into. One of those things is teaching, which is one of the positions that I hold here. So I train all the students who are coming through who want to be radiographers in the future.
Hi, I'm Robin Tucker. I'm the Senior Allied Health Clinician, but my discipline is social work, and I work for Golden Valley Area Mental Health Service. I think I'm in one of the following clips as well. I trained regionally quite a few years ago now with La Trobe, both in Shepparton and Bendigo, and then I've always worked within the region, and I've been with GV Health for over 13 years, and I specialise in maternal mental health, so mums that are pregnant and have young babies, and I also specialise with children between 0 and 12. So there's lots of different roles that you can take within GV Health, and social work is a really, really varied career. So with that, I think we're going to throw to the next lot of videos, I believe.
I have a couple of roles within GV Health at the moment, and I'm a little bit of a veteran. I've been here for 12 years, I think. One of my positions is a Senior Allied Health Clinician in mental health services. It's a staff support and education type role. My other position is as the Perinatal Emotional Health Program Clinician. So I sit within the Child and Adolescent Mental Health Unit doing that, and I ran a program that was called CAMS and Schools Early Action. And we went into schools to run programs around emotional wellbeing, and we specialised in supporting people who are experiencing depression and anxiety. One of the things I'm really working on is how we support women and families in a therapeutic way with the infant as well. So not just treating the parent, but treating the two together. And so there's been a lot of evidence come out about early intervention and about supporting families at an earlier time so that we reduce the risk of further mental health issues in the future. So, well, I didn't start initially as social work. I was one of those little bit of a lost souls, wasn't quite sure exactly what I wanted to do. I enjoyed working with people, but I didn't quite know what, and I didn't quite have the mathematical brain that some of our physios and doctors and so forth had. So I started a Bachelor of Social Science originally, actually, and I did my first year here in Shepparton to sort of save money and make life a little bit easier until I had a licence. And so then I majored in sociology and psychology, and then at the end of second year I made the decision to apply for a social work. I think if you are undecided, keeping your options open by doing a broader range of subjects is helpful. Being open to what people might suggest, because sometimes there are roles and positions that you didn't know about or didn't really understand, and Social work most definitely can be one of those, and you know, even the scope that occupational therapists or speech pathologists or any of those do is that we might have a stereotyped idea of what that might look like. But there is so much variability and such a wide scope. And I've worked over 20 years in the field. So there is longevity, and I guess a lot of people worry that they might burn out or they might not last in this field, or it might be just too difficult. And if you have good support, good supervision, good mentoring, it is most definitely a career that you can have, you know, broad and varied experience and even divert off into other areas and come back in a different way. So health industries, you need to look after yourself. You need to practice what you're telling your patients, most definitely. So, you know, I guess not to be concerned about some of the fear stories that people might tell you as well about some careers or some professions, because sometimes they're just myths about what's happened. So yeah, so ask questions, talk to people within the industry. If you're interested in people-orientated work, do some work that involves interacting with people, even if it's retail, even if it's hospitality, but you're dealing with people.
Thank you. Thanks, Sarah. Thank you to Robin. And I hope you learned a little bit more about some of the diverse health careers that we have here at GV Health. I'm just checking our chat. There doesn't seem to be any questions. So we'll go to our break, and we'll see you after our short 5-minute break. Thanks, everyone.